Conjunctival pathology. The conjunctiva is a thin mucous membrane that lines the inner surface of the eyelid and covers the anterior surface of the globe. Parts of the conjunctiva include palpebral, fornicele, bulbar conjunctiva, plica semilunaris, and caruncle. Palpebral conjunctiva. Marginal conjunctiva is a transitional zone between skin and sulcus subtarsalis formed of stratified squamous epithelium. Tarsal conjunctiva is vascular and tightly adherent to the back of the tarsus. Fornicele conjunctiva represents the reflection of the conjunctiva at the corners, 4 in number: superior, inferior, medial, and lateral. The superior fornix is the deepest. Bulbar conjunctiva. It is loose over the sclera, but at the limbus it becomes firmly adherent. Plica semilunaris is a crescentic conjunctival fold at the inner canthus. Caruncle is a dense fibrovascular triangular elevation at the inner canthus covered by stratified squamous epithelium and contains fine hair. Blood supply of the conjunctiva. Arterial supply. The conjunctiva is supplied by posterior conjunctival arteries that originate from palpebral arteries and supply the conjunctiva and the limbus. Also, it is supplied by the anterior conjunctival arteries originating from anterior ciliary arteries and supply the limbal conjunctiva. Venous drainage. Anterior conjunctival veins draining into the anterior ciliary veins and posterior conjunctival veins draining into the palpebral veins. Both drain into the ophthalmic vein. Lymphatic drainage. The conjunctiva drains to the preauricular. 9. Lymphatic drainage. The conjunctiva drains to the preauricular and submandibular lymph nodes. Microscopically, the conjunctiva consists of non-keratinized stratified columnar epithelium with goblet cells. The substantia propria is loose connective tissue stroma with lymphocytes, lymphoid follicles, plasma cells, and Langerhans cells, which are dendritic cells expressing class II antigen. Conjunctival cytology. Normal cells. Epithelial cells having a round nucleus and homogeneous cytoplasm. Cells are flat squamous epithelial cells. In smear, they appear cuboidal and clump in sheet. Goblet cells contain clump of pale staining mucus displacing the nucleus toward the edge of cell membrane, giving the cell a signet ring appearance. Abnormal cells. Polymorph nuclear leukocytes indicate bacterial conjunctivitis. Eosinophils are present in allergic conjunctivitis. Lymphocytes occur in viral conjunctivitis. Polymorph nuclear leukocytes and lymphocytes. Cells contain basophilic intracytoplasmic inclusion bodies in Chlamydia trachomatis.